Hi, everyone. Thank you so much for joining us today. Good morning, good afternoon, good evening from wherever you may be joining us in the world. My name is Tracy Toothaker. I'm the Director of Recruiting here at Worldwide Health Staff Solutions, and I'm joined by my partner, Mindy.
Hi, everyone. Good morning, good evening.
Today, we are so excited to talk to you a little bit about the University of North Carolina Health, which before I pass it to Mindy to take us through our first few slides, I just wanted to also invite everyone to let us know where you're joining us via the chat. So head into the chat, let us know where you are in the world you're tuning in from. And then, of course, as we go along, please feel free to ask any questions in the chat as well, which we will address at the end of our session today. Okay.
Awesome. All right. So as Tracy so kindly introduced us, we are both the Director and Associate Director of Recruiting Ops over here in Charlotte, North Carolina. We are currently in the Worldwide Health Staff building in Charlotte. And we're going to talk a little bit about University of North Carolina healthcare. So the requirements to interview with University of North Carolina healthcare, you must have and pass your NCLEX. You can be endorsed to any state. Our services will allow and help you re-endorse your NCLEX to the state of North Carolina if you choose to interview and are hired with them. You must also be currently working in bedside nursing and have 2 years of current bedside experience in the specialty that you want to interview for. And the University of North Carolina healthcare also requires you to have a BSN in order to interview. So, for our worldwide health staff RN opportunities, these are direct hire opportunities. We do help with your processing, your immigration petition processing, and we also help with everything in between, from sourcing and recruiting, landing you a job, all the way through arriving and working in the U.S. Even after you have started working, we will continue to help you through any issues or things that you may come across with your new employer. Our immigration services help with the EB3 visa green card. Your immediate family members will be included at no extra cost into your petition. This would be your dependents under 21 who are unmarried, as well as your spouse. An English exam is not required for interviewing. You will be required to take an English exam for your visa screen, but in order to interview and file your petition, it is not required. Reimbursement of your healthcare worker certificate, or commonly known as your visa screen, and your medical exam are both offered for all of our opportunities. You will also be provided free airfare to the U.S. for the RN. Your dependents, if you bring any, will be at your discretion, but your ticket for the RN will be free for arrival. And then at least 30 days of housing will be booked and provided for you upon arriving in the U.S. This is a part of your contract with us and with your new employer. A little bit about University of North Carolina Health. This is a not-for-profit integrated healthcare system. They are owned by the state of North Carolina and comprise of many locations across the state. They provide care to patients in all of our state's 100 counties through its 11 hospitals. They have 13 hospital campuses and hundreds of clinical practices. They are one of our nation's leading academic healthcare systems. They are a $5.4 billion enterprise, and they have more than 33,000 employees from Henderson to Jacksonville. These are both cities in North Carolina. And then they also have 5 adult specialties and 7 children's specialties at the UNC Medical Center that have been nationally recognized by U.S. News in its latest Best Hospitals and Best Children's Hospital reports. The mission and vision of UNC Healthcare is to improve the health and well-being of North Carolinians and others whom we serve. We accomplish this by providing leadership and excellence in the interrelated areas of patient care, education, and research. And their vision is to be the nation's leading public, academic, and community health system with patients at the center of all they do. So some core values that make up the teams with UNC Healthcare, they believe they are one great team, Carolina Care leading the way, and it starts with me. So here are some really helpful numbers from 2024 for UNC Healthcare's many facilities. They have had over 87,000 discharges, 250,000 emergency department visits, clinic and outpatient visits, 3.5 million, over 100,000 surgeries, and they have over 5,000 medical staff members.
Doing a lot. Busy healthcare system. Thanks, Mindy. Yeah, tons of facilities. Yeah, definitely an exciting opportunity. And we feel honored too, because being that we're in Charlotte, North Carolina, we are firsthand witnesses to their reach. So very cool. So UNC Health, a little bit about the position details. I know Mindy touched on this a little bit ago, because this does coincide with the requirements of the majority of opportunities that we have. But again, the roles require at least 2 years of current bedside experience in the unit in which you're going to be interviewing for. And then also you must have, from an education standpoint, your BSN. Some benefits with UNC Health is there's $1,000 sign-on bonus, and then, as mentioned, either $2,500 or 30 days of temporary housing, and so an opportunity to plenty of opportunity to be able to secure temporary housing for the first 30 days. Some of the benefits that we provide, as mentioned, commonly known as the visa screen, is the healthcare worker certificate reimbursement, as well as plane ticket and medical. So super important to keep in mind as you are making a decision to make your journey to the U.S. Okay, so on to the fun part of the current openings that we have with UNC Health. We are going to be hiring for the following units: ICU, women's and children, emergency department, OR, med surg, and progressive care unit. So couple of, there's varying numbers within those units that we'll be hiring for, some more, some less, but all of these will be in the UNC Wayne location, which is in Goldsboro, North Carolina. So for reference, that's about 3 hours east of Charlotte, North Carolina. And fun fact, it puts you even closer to the coast. So you'll be close to the beach, which is exciting. Okay. Some company benefit highlights on the UNC side are that they offer retirement savings, and they also have an employer contribution to retirement savings, life and disability insurance. They have a couple of different offerings as far as wellness and on-site fitness goes, as well as employee health discounts, medical, dental, and vision insurance, as well as an attractive PTO and leave accrual process.
Something else that I actually just realized before we got on the call, they offer something very different than some of our other clients. They help you pay for childcare. So they reimburse childcare as long as you and your spouse are either both working or your spouse is looking for work. They will help reimburse you for childcare, dependent care.
That is a very unique benefit. And so, yeah, great call out, Mindy. Something that is not a lot of employers do. They might have options on site and things like that, but as far as contribution, that's major. So yeah, thank you for sharing that. Okay, so about North Carolina, a little bit about the state. So this was interesting to me because being from Charlotte, North Carolina, I'm a North Carolinian. And I actually did not know that our state population was 11 million people. I actually thought it was less than that. So we are a growing state. I know we feel that in Charlotte a lot. Some other fun facts: the median age is 39. The average commute time is 25 minutes, which I can attest to. That's mine's a little less than that actually, so that's right on par. A wonderful thing about living in North Carolina, you absolutely do get all 4 seasons. And so, on the high end from a temperature standpoint, we're looking at about a range of 85 degrees Fahrenheit, 29 degrees Celsius, and then on the low end, 88 to 29 Fahrenheit, and then 31 to -2 Celsius. And so, we kind of get the full swing for all 4 seasons, which is fun. Average rainfall, 48 inches. The medium home price is $332,000, and then average monthly rent is $1,359. Our airport code, CLT, Charlotte Douglas International, which they are just completed a full revision of. So we've got a brand new airport, very big. It can take you really anywhere in the world.
Lots of direct flights.
Many
International direct flights.
Lots of, yes, great call out. A lot of direct flights out of Charlotte. And to your point, internationally as well. And it's only growing. I think, they've added some more routes lately that gives you more options. So some top reasons to live in North Carolina. We have all sorts of charming small towns and historic cities, vibrant arts and culture scene, access to mountain beaches and parks, and also lakes. We kind of have it all, and especially in thinking about Goldsboro and where you'll be situated if you choose to interview there, very close to the beach, probably, within an hour's drive, and then probably like a 3.5-hour drive to the mountains. So not far at all. And there are some great lakes sprinkled across the state. We've got a couple even here in Charlotte that are huge.
Rural communities and big cities, a little bit of everything in North Carolina.
Yep. And close to each. Mm-hmm. So, you can access really anything you're looking for. In North Carolina, we are famous for barbecue, and that is very much true. We've got a lot of really great dining options, and there's some really just phenomenal barbecue places, even in some of these rural communities across the state. I can attest to that. Top rated schools and respected universities. A lot of folks come to North Carolina for education, and we have several schools in the top 20 from an education standpoint on a university level. And then safe, family-friendly communities, convenient locations along the East Coast. It's beautiful. They call the coast of Carolina the Crystal Coast for a reason. It's stunning, and definitely a strong sense of Southern hospitality and community that's alive and well throughout the state.
I would say this area in particular also is really a big melting pot of ethnicities and cultures. As Tracy said, a lot of people travel from other states to North Carolina for schooling and for tech. North Carolina is a really big tech, healthcare, and I believe banking state. And so in this area in particular is really big in tech and healthcare. And so it brings a lot of other people from outside the states and outside of the United States in particular. So lots of culture.
Great call out. Yeah, good point. And another fun fact is that the cost of living comparison to some of the other more densely populated cities across the country is that it's incredibly affordable. So, housing in comparison to a San Francisco, let's say, and truly, even in just comparison to Charlotte's a large metropolitan, bigger than Goldsboro, a lot more populated than Goldsboro. Even a couple hours away, you have quite a swing from a cost of living standpoint. So,
You cannot find in Charlotte housing for $1,000.
That is fact.
So this is really great.
That is fact. Yeah. So as you can see, housing, I know we said the average rent was probably closer to around $1,300, but just, kind of from a bottom of the options, around $1,000, and, food, childcare, transportation, healthcare, other necessities totaling up to a monthly of, just over $7,500, and then an annual total of, just shy of $100,000, which is incredible because as you can see in San Francisco, you're going to be closer to that $210,000 cost of living need to afford the following listed on the screen. So definitely an attractive point for Goldsboro. Okay. So just a recruiting update. I know I mentioned the units that we are going to be hiring for. We do not have interviews confirmed quite yet, but we are close. We're working on a date, just finalizing a couple of things with our partners over at UNC. And so we anticipate having those dates available within, looking at probably the next 2 to 3 weeks. And so once we have that officially, please reach out to your recruiter if you have questions or need an update. Otherwise, you will be hearing from them about when these will be available to schedule for. So if you're interested, whether you're working with a recruiter at Worldwide yet or not, please feel free to reach out, and you can apply directly to our website. Our host has put the link in the chat to apply directly through the Worldwide Health Staff website, and there you will be directly routed to a recruiter. Perfect. Okay. So we'll jump over to the chat. Feel free to ask any questions via the chat. We'll go through and see kind of where everybody's joining from. We'd love to hear from you. Let's see. Let me back up here. Okay. Rebecca from Saudi Arabia. Stella from Nigeria. Philippines. UK. Kenya. Ghana. Kuwait. Love it. UAE. Hi, Neggy.
Hi, Maggie.
Amazing.
Hello, Anne.
Okay, it looks like we have a question from Lon if we're still hiring dialysis nurses. And we are. So please feel free to reach out directly to your recruiter about those opportunities in particular. If you don't have a recruiter that you're working with yet, please feel free to apply. We'd love to help.
Hi, Diane.
This is so cool.
Wow.
Philippines again. Nigeria again. Lesotho.
Don't forget, if North Carolina is on your list, go ahead and reach out to your recruiter to ask them more questions or to ask to be placed on our wait list for when these interviews come available.
Absolutely.
We are expecting within the next 2 to 3 weeks, we'll have dates for you, and your recruiter will be able to take you from your wait list and get you on a schedule.
Yep. Diane, yes, we are. We're hiring for ICU. So, please feel free to reach out. Just passed your NCLEX. Congratulations.
Congrats.
Working in the UK. Yeah, no problem at all. We're happy to help. So we'd love to get in touch about next steps. Let's see. Francis has a question. Is this a permanent move if accepted in the interview, or is it a contract? So these are direct hire opportunities, Francis. So yes, you would be immigrating to the United States on an EB3 visa for this opportunity as a permanent employee. And this is a direct hire role. Good question. Hi from Nepal, Dubai. Amazing. Let's see. Hiring for care workers. We do hire for long-term care and skilled nursing. If that's what you're interested in, please feel free to apply. Happy to talk to you about those. And let's see. Medical technologists. Yep. While we currently don't have any medical technologist roles that we're hiring for at the moment, but that is absolutely a skill set that we do hire for. We'd love to talk to you about kind of what that looks like. So feel free to apply directly. And then Ernest, sounds like we haven't had a chance to reach out, but we would be happy to get in touch. So if you wouldn't mind, maybe our host can put in the chat our recruiting email that you can reach out to. We can help get you routed to the right contact. Hiring for pediatrics. Yes, we do. We have, we definitely have some opportunities for women's and children, and sometimes that does include some peds aspects. So Marlene, happy to talk to you about what that looks like if you want to apply directly. Let me make sure I'm not missing anything here.
Hi, Angelica. As long as you have 2 years of current bedside nursing experience, our clients will consider you, supervisory or not.
Correct.
And we do hire from Nigeria, Moses. That is one of our biggest areas that we recruit from.
Absolutely.
Thank you so much for applying, Diane. Someone will reach out to you super soon.
Amazing. Okay. Question about laboratory scientists. And I think we're not currently hiring for any lab capacities at the moment, but happy to talk to you about your specific specialty and types of opportunities that we might have in the future. So yes, please feel free to apply directly. We'd love to talk to you about that. Let's see.
Florence, did your colleague, did they apply through our staffing referrals program, or did they apply directly to our site?
It's a good question. We can clarify there.
And then Moses, yes, you can apply with your diploma in nursing. We have lots of nurses who have gotten jobs with our employers with a diploma in nursing.
Let's see. I think perhaps one of these questions might be asking about age limitations. I'm not quite sure, but you need to be at least 18 years old to work in the United States, just for these opportunities, FYI. And then also, Jace, I know you have a question about not having your NCLEX quite yet. Just as a reminder, no, these opportunities all require not only your NCLEX, but also at least 2 years of bedside nursing experience in the particular specialty. So yes, you do have to have your NCLEX. In nursing home care experience, will that be considered? Great question, Angelica. I think in certain units and specialties, it might apply. It just kind of depends on what capacity that looks like. But I guess short answer, yes.
Yeah. The best route is to contact your recruiter so that they can give you the best information and advice based on your particular CV or resume.
Definitely.
John, we do recruit MLTs. We do not have any openings at the moment, but if you go ahead and apply, you will be automatically entered into our system so that we can reach out to you whenever we do have those openings available.
Hi from Ethiopia. Yeah, Stretch, the good question. I know we echo the same.
Right.
We do monitor the visa bulletin very closely. I absolutely encourage you to interact and engage with our social media platforms where we have several different resources as it relates to retrogression and the visa bulletin. Our CEO most recently just did a webinar with one of our immigration partners and talked a little bit about what that looks like, from the November visa bulletin update. So please feel free to check that out. In fact, I encourage everyone to like and follow us on Facebook. Our host just put the link in the chat, and then also our YouTube channel where we do publish all of our other webinars in addition to this one. So go ahead and subscribe to our YouTube channel via the link that was just put into the chat.
Diane, as long as your daughter is under 21 and unmarried, you can also add her to your petition. So you still have time.
Great questions. Okay. All right. So as you can see on the screen here, those are our various platforms that you can connect with us, but we did also put them into the chat. So feel free to follow along with those. We would love to engage with you via Facebook, YouTube, Instagram, of course, our website directly where you can apply. And then also, I know we had a question about this earlier, but we would love for you, if you have any colleagues or friends and family that are also interested in working with Worldwide Health staff, we have a referral program where if you refer a nurse, you can earn $250 for each nurse that you refer. So we'll put our referral program link in the chat also. Feel free, if there's anyone that comes to mind that you refer to share them via that link. Okay. All right. So I know just one other question here. It looks like 10 years of experience. Phoebe from the Philippines. Hi. You have 10 years experience in bedside, no job at the moment for a year now. So yeah, Phoebe, we would be happy to talk through that scenario with you and discuss the options that we might have that you might still qualify for. So really appreciate you sharing that information, and feel free to apply directly. We can absolutely help you work through that. Okay.
Thank you, everyone.
All right, everyone. Thank you so much for joining in.